are demonstrated in technological knowledge.
Since technological nursing as caring model makes life easy. It combines the use of technology between hands-on patient care, and the technologies will help you to identify or reveal the patient's state. It is an extension of treatment that allows for a greater sense of awareness.
Jar, ano nga ba yung theory ni Carolina Abundantes? Diba about yun sa transformative leadership, no?
Yes, tama ka. The theory of Abundantes is focused on 3S, which is servant leadership, spirituality, self-mastery, and lastly, the self-expertise.
Oo nga, no, parang pinapagkita niya na doon kung gaano kahalaga bilang isang nurse na alagaan ng kanyang patient na gumaling.
Tama kasi sinabi mo about sa theory niya.
Hi, good morning. I'm going to give you a tips on how to make a positive impression from dreams. Number 1. Count out humidity. If you're using a vaporizer, clean it thoroughly first so you're inhaling mold or bacteria. Number 2. Take in extra liquids. Drink lots of water or comforting warm beverages, but avoid alcoholic or caffeinated drinks as they can contribute to dehydration instead of preventing it. Number 3. Give your nose some TLC. You can buy a saline rinse at the drugstore or
practitioner on the wellness outcome of the selected project patient. So the significance of the study is to determine the effects of the composure behavior. So nursing as a healthcare profession would prove its worth at being a part in quality performance with other healthcare professions. So we have the composure behavior. Composure behavior are set of behaviors or nursing measures that the nurse demonstrates to selected project patients. The word composure is an acronym which stands for competence. Competence, the ability to do something successfully or efficiently. Next is the presence and prayer. The state or fact of existing, occurring, or being present in a place or thing in a religious service, especially a regular one. Open-mindedness. It is the willingness to search for evidences against one's favored beliefs, plans, or goals and to weigh such evidence. Next, we have the stimulation. Stimulation is the raising of levels of physiological and nervous activity in a body or any biological system. Next is the understanding. It is the comprehension. Next, we have the respect and relaxation. It is the process of honoring someone by exhibiting care, concern, and consideration for their needs or feelings and decreases the effects of stress on our mind and body. And the last in the composure is the empathy. So it is the ability to understand and share the feelings of another. So, the wellness status, it refers to a condition of being in a state of well-being, a coordinated and integrated living pattern that involves the dimensions of wellness. So, we have the physiological outcome and the behavioral outcome. So, the physiological outcome, we have the vital sign, the chest pain, and the hemoglobin. In biobehavioral outcome, we have the physical, emotional, intellectual, and spiritual. So, the role of nurses is that nurses are specifically advanced nurse practitioners are to use the composure behavior when administering the appliance. The ways of intervention, the vinagracious composure behavior is used when providing care to the patient to achieve wellness.
The fat woman used to jog to lose weight and she is used to it and she does it every day until one day she has a cardiac arrest. A heart attack happened when the flow of oxygen reached blood to a section of heart muscle suddenly become blocked and the heart can get oxygen. If blood flow is not restored quickly, the section of heart muscle begin to die. Heart attack treatment works best when it given right after symptoms occur. As you can see, this girl is having a short of breathing. It is a symptoms of heart attack. If you think someone is having a heart attack, have the person sit down and rest to keep calm. Loosen any tight of clothing.
Role refers to the set of shared expectation, focus of a particular position. This may include belief about what goals or values of the position improvement is to pursue and the norms that we covered behaviors. Change of life is the period between near-retirement and post-retirement. Tears in medic of psychologic terms, this equates with the climacteric period with adjustment and readjustment to another tempo of life. Coping approaches refer to intervention or measure of life to solve a problematic situation or state in order to restore or maintain equilibrium and normal functioning. determinants of positive perception and retirement, and positive reaction towards role discontinuity.
Role discontinuity is the interruption in the line of status enjoyed a role performed. The interruption may be brought about by an accident, emergency, and change of position or retirement.
Health status refers to physiological and mental state of the respondents classified as either sickly or healthy. Income refers to the financial affluence of the respondents, which can be classified as poor, moderate, or rich. Work status, status of an individual according to his or her work. Self-preparation, it is preparing of self to possible outcomes in life.
Today, I'm going to tackle one of the Filipino nursing theorists, and she is Carmencita M. Abaquin. Carmencita Abaquin is a Filipino nurse with master's degree in nursing and Doctor of Philosophy in Nursing, degree obtained from the University of the Philippines College of Nursing. She is an expert in medical surgical nursing with subspecialty in oncology nursing, which made her known here in the Philippines and abroad.
Presence is one of the components of Abaquin's Prepare Me holistic nursing interventions. It is being with another person during the times of need. This includes therapeutic communication, active listening, and touch. Reminisce therapy, to recall of past experiences, feelings, and thoughts, to facilitate adaptation to present circumstances. Relaxation breathing. Techniques to encourage and elicit relaxation for the purpose of decreasing undesirable signs and symptoms such as pain, muscle tension, and anxiety. Meditation encourages an illicit form of relaxation for the purpose of altering patient's level of awareness by focusing on an image. Values clarification, assisting another individual to clarify his own values about health and illness in order to facilitate effective decision-making skills.
Cecilia Lorente's Theory of Nursing Practice and Career. Cecilia Lorente is a Filipino nursing theorist whose works focus primarily on helping a patient through support systems, specifically the family. The theory was from her study the categorization of nursing activities as observed in medical surgical ward units in selected government and private hospitals in Metro Manila, which was conducted from January to June year 1987. Nurses' caring behavior that affects the patient anxiety. Presence, person-to-person contact between the client and the nurses. Concern, development in the time through mutual trust, nurse and the patient. Stimulation. Nurse stimulation through words taps the powerful resources of energy of person for healing. Enhancing factors. One's caring experience, beliefs, and attitude. Feeling good about. Learning at school. What patient tells about the nurse coping mechanism to problems encountered. Communication. Predisposing factors. Age, sex, civil status, educational background, length of work, and experience.
In this theory, you'll learn nurses' behaviors that affects patient with anxiety. Let's relieve those anxiety using our caring behavior. The first thing you have to do early rounding. Let the patients or family member know that you will be checking in with them or rounding on them every hour to make sure everything is okay. Second, let your patients be heard. When dealing with anxious patients, the most important skill to learn is to listen. Most patients just want to know that you are listening to their concerns. The next one, explain the what and the why. The majority of patients with anxiety are not frequent flyers. They don't know the hospital routine like some of your other patients. Last is, don't tell your patients to relax. Show them how. Some patients will be able to tell you what they need. If they can't, then help them with some relaxation techniques.
Synchronicity in a human space-time, a theory of nursing engagement in a global community. The synchronicity in a human space-time theory of nursing engagement is advanced as a fundamental to nursing praxis as a theoretically based nursing encounter developing diverse practice-based knowledge and methods. Focus on the life principle of emancipation, inquantability, interconnectivity, and human transcendence. Emancipation, a principle of empowering others to deal with their present problem, have hope for the future, and holistically perceive each other is an essential response to the extant multi-realities of globalization in healthcare. Equitability, an application of the principle of an equality-oriented healthcare system that indicates justice in a human caring. Interconnectivity is the hope for consequential future of globalization in healthcare has catalyzed the development of nursing praxis to the further advance the social model of equitable caring for humanity. Human transcendence, the ability to go beyond the limitation of human factors and space-time influence, has propelled globalization in nursing within universal technological domain. In this global community, the conceptualization of emancipation, interconnectivity, equitability, and human transcendence can be realized as a life principle, challenging persons to embrace the coexistence of conspired modernist and holistic approaches or postmodernist approaches in the practice of nursing and a human caring. Synchronicity is the human space-time. Theory of nursing undergirds the emotive process of nursing. Engagement expressed as interpersonal relating, technological knowing, with thematical connecting, and transformational engaging.